This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey beautiful soul, it's Jacqueline here from the Labia Chronicles, where I discuss all things lichen sclerosus. So if you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend or loved one with lichen sclerosus and you want to learn more about the physical and mental health aspects of lichen sclerosus so that you can better support them in their journey, then please keep on watching and share this channel with them. All right, so in today's video, we are going to take a bit of a deeper dive into the world of vulvar biopsies for lichen sclerosus. I'm going to talk about how these biopsies are performed. I'm going to talk about the ideal time to get a vulvar biopsy because yes, this actually is a very important point and something that both patients and providers should be knowledgeable about. And I'm then going to talk about what they're actually looking for in order to diagnose you from your biopsy. So that's going to be the topic of this video. It's a bit more sciencey, but I'm going to try to break it down and make it digestible. If you have any follow-up questions, please don't hesitate to drop them in the comment box below. I will answer you as soon as I can, and I love connecting with you. So please leave comments. And yes, of course, I do have my free ebook on vulvar lichen sclerosus, which you can get at www.loslabia.com/ebook. So be sure to get your free copy of that. I will leave that linked in the description box. And let's jump into things. You can get diagnosed with lichen sclerosus clinically, and I do have a video on how lichen sclerosus is diagnosed. That's kind of a short, informational, general kind of overview. So if you do want to check that out, click up here or up here. I will leave a card somewhere there and also in the description box below to check that out. However, vulvar biopsies are the gold standard for diagnosing lichen sclerosus. Your doctor might do a vulvar biopsy if they're not confident that your case is lichen sclerosus. So if they take your symptoms and they examine the vulva and there's no clear active signs of lichen sclerosus, or they're just not confident that it's lichen sclerosus, they may opt to do a biopsy in order to get that confirmation. Another reason your doctor may do a biopsy is your symptoms could be explained by a number of vulvar lichenoid conditions such as lichen simplex chronicus, lichen planus, lichen sclerosus, and or other vulvovaginal conditions. So if they're not sure what's going on, and it could be a few things, they may also want to do a biopsy. Another reason that your doctor may request to do a biopsy is if they see anything on the vulva that looks cancerous. This is usually a non-negotiable. If they suspect cancer, they're not really going to debate very much about if they should or shouldn't. They're typically just going to biopsy because obviously the earliest that we can catch vulvar cancer, the best. The quicker it's diagnosed, the quicker you can get on treatment. So that's typically not something that they're going to drag their feet over. They're just going to order a biopsy. Okay, so does it matter when you get your vulvar biopsy? Well, current research suggests that yes, it does matter. Ideally, you would get your vulvar biopsy before starting topical corticosteroids. Now, this is because topical corticosteroids are actually so good at doing their job of reducing inflammation that they can actually obscure the result of your, biopsy. So your biopsy could actually come back as negative for lichen sclerosus or inconclusive if you've been treating with topical corticosteroids. This has been discussed by Dr. Goldstein and Dr. Krapf in their webinar on vulvar lichen sclerosus by the Centers for Vulvovaginal Disease. I am going to link that webinar in the description box below. If you have not seen it, I highly recommend that you give that a full watch. It is incredibly informative, and I truly believe that every person with lichen sclerosus should watch that video at some point. Now, the current kind of best practice is to wait. If you've already started topical corticosteroids, they recommend stopping for at least 2 to 3 weeks before you get your biopsy. However, Dr. Goldstein in this webinar has actually said that it is possible that topical steroids could mask the result, like it could mask a positive lichen sclerosus finding on a biopsy forever. This means that you would never be able to get a definitive diagnosis. So if you are planning on getting a vulvar biopsy, if you want a vulvar biopsy, please note that you ideally would not be treating with topical corticosteroids. And if you are, that you would be taking at least a 2 to 3 break before getting that biopsy. Okay, so you got your vulvar biopsy, your doctor sent your pathology sample to a pathologist. What's a pathologist and what the heck do they do? So a pathologist is basically a healthcare clinician that is going to assess tissues for disease. So they're the ones, they get a sample of your tissue and they're going to look for certain disease. They're going to look for certain markers or features in order to confirm that diagnosis. And I'm going to discuss what the 4 main features of vulvar biopsies for lichen sclerosus include. I'm going to put those up on the screen so that you can kind of follow along with me. Again, for an even more in-depth version of this, I definitely recommend checking out that video by the Center for Vulvovaginal Disorders. All right, so let's discuss the 4 key pathological features of vulvar lichen sclerosus. In other words, what is the pathologist looking for when they get your sample? Okay, so the first feature is hyperkeratosis of the epidermis. This essentially means that there is thickening of the skin in this kind of top layer of the sample. The second feature is epidermal atrophy with loss of reedy ridges. Okay, let's break down those scientific terms. So when you look at a sample of healthy vulvar tissue, you are going to see that connecting the kind of top and middle layers of the vulvar skin, you're gonna see something called reedy ridges, which are basically like finger-like projections that kind of project downwards, and essentially those bulges, those finger-like bulges, they connect and keep the skin together. So they're connecting those top and bottom or mid kind of layers of the skin. But with lichen sclerosus, those finger-like bulges completely disappear. So as you can see, you don't see anything that kind of looks like a finger pointing downward on this slide. And this actually makes it harder for the skin to stay together, which can result in skin tearing and blood blisters. Let's look at the third feature. I'm just going to move my little image here so we can see. So the third feature is homogenization of collagen below the dermal epidermal junction. So essentially, healthy vulvar tissues will have a ton of cells. But when you look at a sample of a biopsy with lichen sclerosus, they don't really have a lot of cells present. And further, there's a lot of collagen buildup, and that is what's responsible for that classic hyper-thickened white skin that you see often, but not always, with vulvar lichen sclerosus. Okay, and then the third feature is that there is a lichenoid T cell infiltrate near the basement layer of the skin. So we don't really have that full image on here, but that's okay. We're going to work with what we have. Lichen sclerosus skin will show a lot of white cells in the bottom layer of the skin. And now that presence of those white cells essentially means that there's a lot of inflammation. So when we have that protein or collection of proteins in the basement layer of the skin that the body identifies as not self, it's going to want to protect the body from this intruder, this not self intruder, and it's going to attack it. That attack basically is a really big inflammatory response. And that's why there's a ton of inflammation that can be seen on vulvar biopsies with folks with lichen sclerosus. Now, I just want to note that these slides are just for the purposes of illustration here, but I'm not a medical doctor, so I don't have access to actual biopsies of folks with lichen sclerosus or folks without lichen sclerosus. So this is just a standard run-of-the-mill kind of biopsy of lichen sclerosus that anybody can find off of Google. So I just wanted to put that disclaimer out there. And then further, I wanted to note that for a really good in-depth kind of explanation of this, I really recommend that you check out the Center for Vulvovaginal Disorders Lichen Sclerosus webinar. In this webinar, at around the 30-minute mark, Dr. Goldstein is going to compare and contrast two biopsies, one of healthy vulvar skin and one of lichen sclerosus skin. And this is really important and helpful because you can see plain as day this thickening. You can see the big finger-like projections on healthy vulvar skin and how they're completely absent. You can see that band of, collagen. You can see that inflammatory kind of lichenoid T cell infiltrate at the bottom basement layer of the skin. So you can kind of compare and contrast those excellent vulvar biopsy images with a explanation from one of the top vulvar lichen sclerosus specialists. So highly recommend checking that out if you want more in-depth kind of detail on what your pathologist is going to look for when they're trying to confirm lichen sclerosus. So let's talk about getting your biopsy results. So once the pathologist has looked for those 4 features of lichen sclerosus and they will give those results back to your doctor. Your doctor will then connect with you, however they connect with you, I don't know, that will depend on your country, but they will contact you and discuss the findings. How long it will take you to get your biopsy results will honestly depend on the country you live in and the backlog that the healthcare system is currently working with. I can tell you that at the time that I am filming this in Ontario, Canada, it takes approximately 2 to 3 weeks to get your results. But again, that time could vary. Now, once your doctor gives you the results, they'll have a conversation with you about what they found. If there's a diagnosis, they will talk to you about treatment and, prognosis. If there's no diagnosis, if the findings were inconclusive or if it was negative, instead they might set up an appointment for more testing and more kind of investigatory measures to kind of figure out what's going on with your vulvovaginal symptoms. Now, some important notes that I just want to stress before kind of wrapping up this video is that your doctor should be very transparent with you throughout this whole process. They should be explaining where they're going to do the biopsy, why they're going to do the biopsy. If they're doing multiple sites, they should tell you why they want to take multiple sites. They should explain every step of the process, and this should be a dialogue between you and the healthcare provider. It shouldn't just be your healthcare provider talking at you. It should be a conversation, and you should be able to ask questions at any step of this process. All right, so I do want to acknowledge that vulvar biopsies can be incredibly painful and emotionally distressing, and that is why the next video is going to go through a ton of tips and tricks to help make this process as comfortable as it possibly can be. All right, beautiful soul, that is it for this video. Thank you so much for watching. Please subscribe and leave this video a thumbs up, and I will catch you in the next one.